Talk 1480 WHBC.
The following program is sponsored by the Medicine Center Pharmacies.
Good morning, welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and, of course, our socially distant technical producer, J.D. DeAngelis. We continue our shows from our administrative offices and wish our friends at WHBC and our listening audience continued good health. Our guest today is Dr. Dale Duerr, veterinarian and founder of Town & Country Veterinary Clinics in Tuscarawas County. Dr. Duerr, welcome to the show. Thanks for joining us, and we're looking forward to talking to you today.
Thank you for being here. I enjoy the invitation. I'll be happy to talk with you.
All right. Hi, this is Brad White from the Medicine Center Pharmacy in New Philadelphia, and we specialize in compounding pharmacy. For many of us, our pet is a loved and valued family member treated with respect and care. We're excited today to talk with Dr. Duerr of Town & Country Veterinary Clinic in Bolivar in New Philadelphia. Today we're going to discuss a wide range of topics, including fleas, ticks, heartworm, and COVID-19. So if you're wondering if your pet can get COVID-19, or you're worried about separation anxiety with your pet when you're no longer working from home, you're not going to want to miss today's show. As a reminder, right now you can listen to our program on WHBC 1480 AM. We will later on have this on our podcast, and you can get that podcast from the App Store in your favorite smartphone's directory. And you'll also be able to catch our YouTube video of the Zoom conference, which will be posted up to both our pages later today on Facebook. So without further ado, let's get on to the show.
Okay, Dr. Duerr, welcome to the show again. Please tell us a little bit about yourself and your background.
Well, I graduated from the Ohio State University back in 1967. I went to Pennsylvania on a 2-year internship, and then I came back to New Philadelphia and started the practice at the site that we are today. So the years went along. We've had veterinarians that have joined me. Today's owner is Dr. Duerr, and he's also accompanied by Dr. Seeley and Dr. Carl and myself. So that's the situation of our clinic, and we are located in New Philadelphia, and then we also have a satellite practice in Wilshire Hills in Bolivar.
Okay. So tell us about Town & Country Clinics. When you founded them both, I think you got part of that, but what types of animals do you care for, and what are your particular areas of specialty?
Well, yes, we have the main hospital in New Philadelphia, and then the clinic or outpatient clinic in Bolivar. We take care of companion animals that the family may have, and that includes cats, dogs, some exotics, and pocket pets. And we also have at times the practice itself has dealt with a lot of different areas. We have complete surgical and medical services as well as dental, and we're going to talk about that a little bit later today, I think.
Dental, gee whiz. So, fleas and ticks are becoming a year-round nuisance. Why is that, and be protecting our pets?
Well, it is a changing time. It seems like with the increased change that we're having in warmer winters like we had this past winter, we are seeing an increased amount of insect insult on our pets. And we all know that, especially the last few weeks as we've been out with our pets walking to try and get some fresh air, we're seeing ticks already. And in our area, we have ticks that are almost as active in the winter and cool times as they are in the summer. We used to always think of tick season being from basically Memorial Day through till 2 or 3 frosts in the fall. But the new one is the Lyme's tick or black-legged tick, and that one is active year-round.
So they don't freeze. They don't freeze in the winter, or would they freeze in the winter? And what do we say? A normal winter?
Well, they have to be out in the open for that to happen, and the temperature would have to be pretty cool for 4 or 5 days. With a lot of the ticks, the larvae or eggs are protected by mulch around our houses, leaf coverings, and all those type of things. So they have a lot of ways to survive, and so they're with us a lot more than they used to be, it seems.
So some folks, as you said, more people are out walking and shall we say, alone or in the woods or whatever around their properties. So I hear some folks saying they treated their pet, but still are discovering ticks on their dog when they come in from the walk. What do they need to do differently? Well,
a couple of things. I think, first of all, you want to make sure that the product you're using for fleas or tick prevention or killing the tick and flea is going to be on there properly applied. So you want to consult with your veterinarian as well as read the literature that's on your packaging. Make sure it's being applied in a timely manner, and also that it's the proper product for controlling the ones that you want to control. And the other thing, if you've been out walking and you come back from a walk, it's always good to do a tick check, not only on yourself, but on the pet. And they frequently will have gotten on the feet on long-haired dogs. They can get on very easily as you walk through higher grass and up around the ears. The dog's, is always checking things out with their nose. And so it's easy for a tick to get on an ear. And so around the head and neck, we always want to check. If you do find a tick on the pet, even though you're using the product, that's not the disaster. You just need to simply remove it by taking the tweezers, pulling on it very firmly, and that will take care of getting it off. And then to kill it, you should put it between tissue paper to squeeze it or kill it, and then dispose of it properly. Do not squeeze it with your fingers and crush that, because it perhaps has blood meal, and if it has bacterial infection in its system, that could get into a cut on your hand and infect you.
So this is the tick is a burrowing insect. Is that not true?
Yes, a tick has mouth parts that attaches, and it has to use blood meal from an animal or a bird or us, and in doing so, it stays attached for a period of time until it has finished feeding, and then it drops off and continues its life cycle.
Interesting. So what about other insect-borne diseases that we should be concerned about?
Well, we think about other ones such as Ehrlichia, Lyme's, of course we talk about that, and Rocky Mountain spotted fever and anaplasmosis. All these are diseases that can be carried and transmitted by ticks. And the other thing that happens in our area of the country, we have an abundance of wild white-tailed deer. We also have wild turkeys and a lot of other birds of the poultry family. And those two are involved with the life cycle as well as the white-footed field mouse. So all those are involved with the process of the life cycle of the tick.
Interesting.
Is itching always a sign of fleas, or are there other skin issues or concerns that we should be aware of?
Itching is simply a symptom. It can be associated with fleas, and so we always want to look at the animal first and check to make sure that we aren't seeing fleas on it. And the way to do that is use like a real fine flea comb and push the hair back. And sometimes you will not find a flea, but you may find the flea excretion, which is looks like peppers gotten onto the skin. So you know they've been there. There are other causes for itching, of course, and probably the most common in our area is the atopy or allergies that dogs acquire. And we all know if you have allergies yourself, at this time of year, we have pollen flushes from trees, and we soon have grasses coming on, and as you get into fall, you have the weeds. So all those things can cause a dog to have itching or allergies too.
Okay. Dr. Duerr, let's talk about Lyme disease. You touched on it earlier, both from an animal perspective and a human perspective.
Well, from an animal perspective, we see that years ago we rarely had a problem, but as the ticks have become more prevalent, we're seeing that. The signs in the animal would be stiffness of joints, and severe cases or acute cases, they actually become systemic, can affect the kidneys, and they'll run a fever, they'll be anorectic or not want to eat, and so they become very ill, and in some cases, if untreated, can cause death, although that's rare. The most common cause is the stiffness and lameness because it affects the joints. And as I understand, the same thing applies to people. There is a test, and when we do the wellness exam every year on an animal, we are checking not only for heartworm, which we are routinely doing, we also check for Lyme's disease, Ehrlichia, and Anaplasma. So that test will be determined by your veterinarian to be either negative or positive for those diseases. And so it is a disease we're concerned about because if our dogs bring ticks in, they can get on us, and we are more prone to getting an infection as well.
Rocky Mountain spotting fever is not common around here, is it?
No, it isn't. It's pretty rare here. I don't know that it is either diagnosed often at all in Ohio unless you've traveled. It's more of a southern and southwestern Ohio or United States issue. But Anaplasma is and Ehrlichia are here.
You're listening to Health Matters with the Medicine Center Pharmacy.
Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Hi, Paul White from the Medicine Center Pharmacy. From 1976 to the new year, 2020, we've been part of the Canton community. This year, we celebrate 44 years of service. Thank you for your business and continued support of the Medicine Center Pharmacies. A lot has changed in the pharmacy world over the past 44 years, but one thing hasn't, our commitment to your health. Stop by your local Medicine Center Pharmacy in Canton, Louisville, Minerva, or New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Welcome back to Health Matters with the Medicine Center Pharmacy. Brad and I are talking with Dr. Dale Duerr, veterinarian at Town and Country Veterinary Clinic. Have a question, post it on our live Facebook feed.
Doctor, is Lyme disease preventable for our pets?
Yes, it certainly is. And the thing that's happened in the last 2 years, there is now a vaccine, Lyme's vaccine for dogs. And in our area, we strongly recommend it because of the high exposure rate that we have. However, with that said, we still need to use what we can use effectively on our animals for control of and killing the tick. The products that we have today are much improved what they used to be. We now have a collar that is effective for 8 months. We have a topical that has to be put on monthly. We also have oral products, and those are chewables. The one is available that is good for 3 months for a dog and 2 months topically for a cat. So there's a lot of products out there, and you need to discuss that with your veterinarian and make sure that you're using the proper product because that is very important, and it's important to be used year-round, not just during the summer months.
So what if we talk about dental health in animals? Why is dental health important to pets?
Okay, well, dental health is something that we as veterinarians probably for many years didn't pay a close enough attention to. But in the last 15, 20 years, we realized how important dental health is because of the infections that occur in the mouth do affect our other organs in the body. And severe infections can end up causing heart valve issues, kidney disease, because when you have bacteria in your bad mouth, it's being shed into the bloodstream, which is then transmitted throughout the body. So for me, dental health is very, very important. And I just feel that as we see our pets aging and getting a longer life due to the fact that you as pet owners are doing a better job taking care of them, we also need to pay more attention to the mouth.
So I know we have to brush their teeth, the dogs. And what about, do you fill the teeth like we fill humans' teeth? You just pull them all, or if they're damaged or deteriorated, or how do you do? What do you do?
Well, we do have to extract some teeth, but we sure would prefer not to, because as I say, the dogs and cats do seem to be living longer, and they need that dentition to take care of chewing the food properly. To answer your question more directly, Paul, there is, on the annual physical, which for most animals should be yearly, and as they get older, really every 6 months, because we're putting a lot of years and our terms into that animal's life in one. And so on that exam, your veterinarian should be able to see what all is going on in that mouth and examine. And we do have to periodically clean those by using ultrasonic and hand scaling. And yes, brushing teeth is important, and I really encourage that. And that should be an everyday occurrence. We really work with puppy owners to try and get that animal used to that early in life, because we're not going to be able to control all the tartar that forms, but we can sure control a lot and slow that process down.
So human toothpaste, or what are we using on our teeth?
We usually recommend an enzyme paste specifically for dogs. The problem with human paste is that they have a lot of flavoring and products in them that can upset the dog's stomach. We know that when you brush a dog's teeth, he's going to swallow some of that. So we prefer that. And if you have an adult dog, you still can start to brush his teeth. You just have to work with perhaps a finger cot like you use for babies on your finger. It has little nubbies on the end. And it doesn't need to be a long process. If you go in and out, up and down on each side for 5-10 seconds, you probably have done the job. And with the enzyme paste, what's left in there will help slow down that process of accumulation of tartar and eventually calculus on the tooth.
That's pretty interesting. It really is. So the life of the teeth in an animal, and I don't really recall how long a typical dog will live, but the food that they eat and consume, and is generally soft as I see it, but dogs are always chewing on a hard bone or something like that. Are they good or bad?
Well, chew toys are important for two things. One is they help with the boredom that poor dog has, because we all know that a lot of our dogs suffer from separation anxiety during normal times when we're working and they're left alone for long periods. The thing that we see with them is that we need to use dent chews, those kind of things that are going to be helpful by when the tooth comes down on that, it pushes any tartar off that's formed on the outside. And we have to be very careful, though, in that very hard animal bones, like beef bones, etc., if they're used, are only short periods, because the dog's jaw has tremendous pressure. And you alluded to earlier about a fracture. That happens fairly frequently where we have a fractured tooth. And it's because of bringing that pressure down and snapping a piece of the enamel off. The other question you'd ask, and we didn't really address, is what do you do with that tooth? Well, your veterinarian will be able to examine it. If it's just chipped into the dentin, then it could be sealed and protected. If it's chipped down into the canal, then that tooth has to either be extracted or it has to have a root canal, because that's live pulp chamber exposure there, and it's contaminated. And that will eventually abscess out, and it's painful to the animal.
So we don't fill their teeth?
No, not very often. That is a procedure that's really not been done much. The thing that we see with dogs, they rarely have caries as we know them. And part of that probably is the way the structure of the mouth. In the dog, the upper jaw is slightly wider than the lower. So the upper teeth come down over the lower ones. And so they chew by shearing, and that's how they break up food. Whereas we chew as a table surface. Our teeth are flat and we chew on top. So that's why the tartar forms on the outside of the dog's teeth, and that saliva, which is there to help with digestion, is flowing down, and that brings all that material on the outside. Whereas us, it rolls to the inside. And if you've had your dental hygienist talk to you, she's working on the inside of your teeth mostly to clean that tartar off.
Okay, Doctor, it's about on the hour. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Stark County Sheriff George Meyer.
Citizens need to step up and do their part and help make the United States and Stark County healthy.
Provided by News Talk 1480 WHBC.
The Half Off and Out by Store in Louisville is open. That's right. It's open, and it is really open. usual hours, we've stocked up with necessary paper products, cough cold, vitamins, and many other healthcare products. We have a very safe environment with hand sanitizer and wipes for use at our entrance. And we also have a new acrylic screen to protect you at our cash register. We think we can fill most of your healthcare needs also, and our Medicine Center pharmacies all have efficient drive-through services for prescriptions and additional healthcare products.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER, just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult times, please stay calm and make sure your medical and healthcare supplies are well stocked. Have Kleenex, pain relievers, fever reducers such as Tylenol, and cough syrup like Robitussin, Dayquil, cough drops, and maybe a humidifier. And make sure you take a good multivitamin like Linus Pauling Super Multivitamins. Also, you might get a good probiotic, and make sure that you get plenty of rest and plenty of nutritious food. The Medicine Center Pharmacy in Canton, Louisville, Minerva, and New Philadelphia.
Your severe weather station. News Talk 1480 WHBC.
Center. I'm your host and pharmacist, Paul White. Today, Brad and I are discussing pet health with Dr. Dale Duerr. We've got a lot more to cover this morning, so let's get back to the show. So, Doctor, why do dogs always seem to have bad breath? I don't think I've ever been around a dog that didn't have bad breath.
Well, there's a couple reasons for that, Paul. First of all, if there's extremely bad breath, it smells very rotten to us, so to speak. But that can be caused, depending on the animal, by things other than the teeth. We have dogs that have lip folds that trap and hold saliva, and some dogs that have beards, like schnauzers and so on, they tend to trap a lot of saliva and bacteria when they eat in their hair around their mouth. And so if that's causing it, sometimes there's just simply wiping with a towel or keeping the beards dry as you can helps. Sometimes there actually will be infection in the lip folds that needs treated with antibiotic. And so that can be a cause. The other cause, of course, is periodontal disease. And periodontal disease is unfortunately too common in our pets today. And a lot of that comes from, as you alluded to, the softer diets and processed foods that they get. And we have to understand how that occurs. There is a gum sulcus, or a little space between the gum and the crown of the tooth. And once that's irritated or inflamed, it tends to swell. And as it swells, it pulls away from the crown of the tooth. And when the dog eats, food particles get down into that sulcus. Bacteria then grows if we haven't brushed the teeth. And as a result of that, the infection starts there. And the more it occurs and the more often, the more that gum pulls away from the tooth. And pretty soon we have a large sulcus, or cavity there. And when it gets deep enough, it is going to affect the root. The teeth will become mobile. And at that point, they are probably not going to be saved because they have no value there as far as chewing. And they become somewhat painful to the animal as well.
I see dog bones advertised that say, this will fix your dog's bad breath or something like that. Is that the real deal or not?
Well, a lot of those have chlorophyll products in them to help the breath. They're going to help temporarily, but if there's some underlying cause, such as periodontal disease, then we're probably not going to see much effect long-term from that. There's a variety of those out there. Some are better than others. If you look on the packaging, they will have the American Veterinary Dental Society approval or non-approval, which may help you a little bit make a judgment which are being more effective, because that group of veterinarians, which is a specialty group, does do testing on those to determine what are effective.
So none of them are antibacterial?
No, not. No.
It's just a cover-up.
The other thing that occurs, and especially we should talk a little bit about the cat perhaps, we see a lot of severe gingivitis or gum inflammation in cats, and there seems to be a problem in cats that we have yet to identify causes for, but it's called plasmacytic lymphocytic gingivitis, and it affects all the gingiva or the oral gum tissue as well as the pharyngeal area in the back of the mouth, and it becomes fiery red. With it, we frequently have what we call subgingival caries, which is a carie below the gum line. And unlike dogs, the cats do develop caries. And those, when you x-ray them, you'll see this tremendous hole. It's actually eating into the canal, the pulp canal of the tooth, and they are very painful. Those cats will slow down on eating. A lot of times they will actually have very painful chewing or not chew, and they lose weight. And with those, we have to right away, first of all, get an x-ray of the mouth and see where those caries are, how many teeth are affected, get the ones out or extract the ones that are affected, and then we need to a lot of times treat with anti-inflammatories or some antibiotics. But they can be controlled, but it is a problem that we see in cats primarily.
What's the lifespan of a cat, typical cat?
Oh, we see cats that are 21 years old. But I suppose as the average, we say they're 15 to 18. And that is longer than most dogs. And in dogs, we talk about the longer the life, the smaller the dog usually. And again, we see those getting in the upper teens pretty routinely. Unfortunately, the larger breeds, you take like the Bouviers and the Danes and the Dobermans, et cetera, we don't see quite as long a lifespan. We probably have more in the neighborhood of 12 to 13 years, and some of them, unfortunately, can be have problems that will cause premature death at 7 or 8 years.
Interesting.
All right, so you've mentioned brushing your dog's teeth a couple times. For our listeners that are just joining us, could you touch on the right kind of toothpaste to use? I just had a question come through on Facebook about that.
Okay, sure. The enzyme pastes that are out there, and some of them have flavoring in, but they are a paste that will help to break down the food particle, and not antibacterial, but they will help by removing some of that plaque that may be in the sulcus I just talked about that would lead to periodontal disease. And, you know, people look at me sometimes when I say that we need to start brushing these teeth. But if we can do that, I definitely can see a less likely that we're going to have to address treating and doing a dental cleaning in the hospital like we have to do as often. And there's always some concern with the client, and I understand when we have to clean a dog or cat's teeth, they have to have anesthetic. We have no luck having them sit there and say, no, you need to hold your mouth open for us. That doesn't work in the animal. So we do have to have anesthetic. However, with today's anesthetics and the monitoring that we do, I feel much safer than I did 20 years ago when we had to do that procedure. So it's done every day, several times a day, and it is much better. The risk is much less than the risk of not addressing the severe periodontal disease that occurs. So that is done by one of our registered animal technicians, and the veterinarian is present at the time. We scale the teeth off with ultrasonic cleaner after hand scaling, and we check the pockets like they do for you with a probe, and we measure on each side of the tooth to see how deep that pocket is. And if we keep a chart which shows if we have pockets that are, let's say, 5 millimeters versus 3, and we then next time we clean that animal's teeth, we know to watch certain areas that were potential problem prior.
Dogs, I guess, frequently chip their teeth. They're chewing on sticks and chewing on bones, hard bones, all that stuff. What do we do about that?
Well, we alluded to that a little bit earlier, but we need to look at that tooth pretty closely and see how deep the chip is. Superficial chips, like a tip, and does not get down into the pulp is not a problem. Sometimes we'll be able to just smooth that off and seal it and protect it a little bit. If it is deep, then it probably has to be a tooth extraction, and we sure don't like to see that on young animals, but sometimes that does happen. We've actually had to, in some cases, because of the fracture of a canine, which is a large front corner tooth, put after you do a root canal, we put a cap on there. The caps that we have to use are somewhat fragile, so we have to really alter future chewing once we do that. It happens once in a while in some of the police dogs that are used in service because of the way they're working on certain products that they might normally not want to bite into. But if they're hard and they break, then they need to be addressed.
So you don't do posts, and you don't put a new tooth in there. Well,
when we talk about putting a crown on, we would, in some cases, in a few, I have had that done. We have a dental lab. We take an impression. The dental lab makes a crown. Now, in those cases, we have addressed what's going on lower, but there is a crown applied, and yes, it has a post.
Wow.
But that's not the normal.
Okay. Would that be principally for large dogs or not?
It seems as though the large dogs do tend to be the ones that will break or fracture a crown much more prevalently. The other tooth that gets affected frequently is the first upper premolar, and that's back along the cheek. And that one is used a lot of times when they get a hard bone and they get it back in the back of their mouth and they bite down, the tip of the upper tooth can chip pretty easily because it's creating a torque that's not normal for it.
Well, I think, Doctor, we can take a break here. This is our last break. You're listening to Health Matters with the Medicine Center Pharmacy.
Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The Half Off and Out by Store in Louisville is open. That's right. It's open, and it is really open. Usual hours. We've stocked up with necessary paper products, cough cold, vitamins, and many other healthcare products. We have a very safe environment with hand sanitizer and wipes for use at our entrance. And we also have a new acrylic screen to protect you at our cash register. We think we can fill most of your healthcare needs also, and our Medicine Center pharmacies all have efficient drive-through services for prescriptions and additional healthcare products. Is CBD oil right for you? That may seem like a simple question, but the answers don't come from a convenience food store or a mall kiosk. Your Medicine Center pharmacist is the most accessible healthcare professional. Our pharmacists have been trained to provide expert CBD oil information to tailor therapies like CBD capsules, tinctures, lotions, and ointments to your particular need. We have the highest quality, organic, Colorado-grown, non-GMO, full-spectrum CBD oil products. Visit the Medicine Center pharmacies in Canton, Louisville, Minerva, or New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? And a good multivitamin like Linus Pauling Super Multivitamins that you'll find only in the Medicine Center pharmacies. So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Are you tired of spending time sorting your medication? Hi, pharmacist Paul White for the Medicine Center Pharmacy. Whether you are a caregiver or personally take medications, our pill packets will change how you take your medication forever. Instead of multiple pill bottles, you'll want to receive one easy dispensing box that contains all of your medications in individual packets. Organized by date, time, with instructions clearly labeled, it's simple, convenient, and safe. Call or stop by your local Medicine Center pharmacies in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show.
Well, I think we would be remiss if we didn't touch on what COVID-19 and how it's affecting pets. We've seen some news out there about maybe cats can get it, maybe dogs can't. And now I saw, I think, a couple days ago that maybe a dog has it. So what's the bottom line on us being concerned about our furry friends?
I don't feel at this point that we need to be extremely concerned, but we as a profession are surely watching what's happening. And there has been both cat and dog positives. And in my understanding, most of them have been very mild or asymptomatic, but they were animals that were housed or lived with COVID-19 positive people. So I think at this point, if you suspect that, you need to discuss it with your veterinarian. There are tests that can be done, but I don't think at this point that's going to be widely done unless the health department is recommending it in your region. The reason that the CDC has issued one concern about pets is that one scenario would be, let's say that you have COVID-19 and you inadvertently sneeze or cough, you're holding your pet, and unknown to you, you sprayed that droplets from your sneeze or cough all over the back hair of your animal. It becomes scared. It runs in the other room, jumps up on your daughter's lap. She hugs the dog and says, "It's okay. It was not scary, but it just happened." And there you go. She's been exposed because that is there. So the CDC has recommended that if you are positive, that you not only isolate from other humans, but you also isolate away from your pets.
Well, it's, I think one of the first animals they tested was in the Bronx Zoo. It was a tiger or a big animal that they claim had the coronavirus. Why would they early on have testing equipment for dogs, cats, in this case, a tiger? Or was it sort of a homemade test from the Bronx Zoo that detected this? And I guess how does it affect animals? Same as humans? They have the same symptoms?
Well, the signs that I've seen and read about have been primarily respiratory, and as I understand, those large cats that were in the Bronx Zoo were exposed by a handler, and they had a basically respiratory, as if your kitty would have upper respiratory. It would be sneezing, ocular eye discharge, and I think they ran a slight fever. They had to test those. They had to anesthetize them, of course. So they only did one, as I understand, there because of that. But I don't know that they really had a lot of therapy involved. They pretty much, through the immunity of their own, got rid of it. But it is a concern, and our profession is going to be watching this because we surely don't want to have that become an issue, not only for them, but for transmission as what we call a fomite or a carrier to the human population.
Well, I know dogs can cough. Can cats cough?
Sure, yeah.
Isn't the symptom of the coronavirus a dry cough one of the symptoms?
Well, in humans, and other than what we know about these upper respiratory that we've seen in the animals, we don't know that symptom's a lot different. We seem to see this when the nasal passages and the pharyngeal passages are affected. You're going to have increased secretion of fluid, and that stimulates the sneeze and the cough because of that running down the back of the throat of that animal. So there's a lot to be learned about this particular virus, and that's why they call it a novel virus. It has a lot of different behaviors that are not common with the normal influenza-type virus.
Doctor, why don't you give us some information about your practice before we wrap up the show today?
Okay, sure. We are located in East High, New Philadelphia. That's our main clinic. Our hours are 7:30 to 5:30, Monday through Friday. Saturday is 9 till 12:30, and 8 till 12:30. We have a staff that we're very proud of. We have veterinary technicians, registered veterinary technicians who are very dedicated and very educated as far as the diseases that we deal with and their things that we need to have them help with, the techniques. They're very involved with us when we give anesthetic as well as the surgeries. We have assistant techs, and we have very informed receptionists who can answer questions if you call in. And both that clinic and the one in Bolivar, which is an outpatient clinic, in other words, we do not do surgeries there. It is located right next to the Giant Eagle in Wilshire Hills. And you can check us out on Facebook. That would be Facebook with the hashtag TNCVC. And our email is, of course, tncvc.com. And our phone numbers there are 330-339-2363 in New Philadelphia, and 330-874-2511 in Wilshire Hills. And again, Dr. Yosik, Dr. Seeley, and Dr. Carl are the veterinarians involved along with myself. And even though we've had the COVID-19 issue, we are open to help you. It is a little different. You call in, have an appointment, And we do expect face cover if you come into our lobby at the reception area. But we try to handle that. Our technicians will get the animal, they bring it in, do the treatment, and then we talk with you on the phone about the plan or what we found, etc. So,
hey, Doctor.
That's kind of it.
Our guest, Dr. Dale Duerr, a veterinarian in Town and Country Veterinary Clinic. We would like to remind our listeners, if you suspect you have a health issue, please contact your healthcare provider. Thanks to our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course, technical producer J.D. D'Angelis. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again on News Talk 1480 WHBC.
Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.
News Talk 1480 WHBC.